St. Peter's Health Partners is a nonprofit integrated healthcare delivery system located in the capital region of New York State. When COVID came, we had difficulties in terms of capacity in our hospitals because patients were there for an extended period of time, and that really created an issue with new patients having access.
The ED diversion program stemmed from the fact that we were going into COVID, knowing that there was no way we were going to be able to care for all the patients that needed our help who were coming in through the emergency department. So we pulled together a multidisciplinary team to keep these patients in their homes and do all that we could to free up the beds in the hospital for the patients who really needed to be here. One of the challenges that we've always had is that you couldn't, prior to COVID, send patients home from the emergency department on oxygen. We had to find a way to get the ED providers comfortable with prescribing oxygen, and then find a way for the COVID patients to be safe with new oxygen and this new disease that nobody really was very familiar with.
We go over anything and everything that they need to know about COVID and how to take care of themselves. Then everyday calls after that for 2 weeks. Having a nurse being able to call them on that daily basis really helped them to stay at home.
We had a system set up where they would establish the patient with a primary care provider so that we could keep that person out of the hospital if at all possible.
Home care offered the ability to get to the patients quickly before the patient ever gets to their primary care office. It's just that extra level of security to make sure the patient really is safe until they're seen again.
We work every day as an integrated health system on patient transitions of care, but this was an opportunity to come together in an entirely different and creative way in a very short amount of time to solve a big problem. That everyone saw how everyone could come together and do that sets a wonderful precedence for other problems that come in the future.